Hello everyone, good morning. Hope you enjoyed learning useful tips and tricks for OET, IELTS and PT exams through over 300 videos on my YouTube channel. More than 12,000 students have achieved their desired scores after receiving my courses. If you find my videos helpful, please like and share them with your friends, colleagues, WhatsApp and Telegram groups. Also, write your comments and subscribe to my YouTube channel. To get more benefits, please click the join near the subscription icon and follow the instructions or use the link in the description section of my videos to become a member. If you become a silver member, you will be able to access all the exclusive members only videos by paying only $5 per month. It's going to be approximately 250 to 300 Indian rupees per month. If you become a gold member by paying $14.99 per month, which is going to be approximately 750 to 800 Indian rupees, you will be able to access all the members only videos, plus you will be able to receive 10 sets of test materials for IELTS, OET and PTE exams. If you would like to become a platinum member, you can do so, for which you will be able to get the free assessment for 2 speaking and writing mock tests, and then there is an assistance with the 2 full reading and listening tests. You are going to be charged at $79.99 per month, which is going to be approximately 4,000 to 4,100 Indian rupees. To increase the chance of passing your OET, IELTS, and PT exam in one attempt itself, please contact me at steve@ucaneenglishttutoring.com or +61 468 480 877, which is my mobile as well as WhatsApp number. In return, you will get the free correction of your first letter, first essay, and first speaking mock test to help you find your weak areas.
Let us start the assessment of this role play now.
Good evening. I'm Nitya. I'm a registered nurse working in this department. How Michael is doing today?
Oh, it's great. Okay. The healthcare professional already knows Michael, the patient. So the introduction is apt. I'm very happy with the way she has been doing it. So the introduction is perfect. So this is a known case. The healthcare staff already knows the patient. So you can start introducing your name, and then you can straight away ask the patient's name. Okay, you straight away uses the patient's name. All right, let's go to the next one.
Oh, Michael is not doing well. He's complaining pain always.
Oh, I'm really sorry to hear that. But I would like to inform you that some amount of pain is expected after the operation.
Okay, that's good. Yeah, so a great way of explanation. All right. So she has been polite. She has been telling like some amount of pain is expected after the operation. So that's good. All right. I'm happy with that. So when you say is expected, it's going to be the passive form, which is polite. Okay, so it's good. Let's continue now.
Okay.
Yes, okay, but I don't know why he's, getting much higher degree of pain, and he's like always crying, that make me sad.
Yes, I can understand. As a father, it is very difficult for you to see your child in pain. But
that's good. Yes, think from the patient's perspective. Yes, you are doing a wonderful job, Nitya. So think from the patient's view. You need to think always from the patient's view. So you have done a wonderful job in this case. So you need to say, as a father, as a mother, I can certainly understand what kind of problems you're facing, or what kinds of anxiety you are going through. I can definitely understand the rough situation at the moment. So you can use these kinds of phrases in order to think from a patient's point of view, and you have done a wonderful job. Let's continue now.
It's nothing to be worried. We will give you pain medication for your child. That will help him to reduce his pain.
Okay, you have committed a false start. So instead of saying that will help him to reduce the pain, you have said that help again. That help. Okay, so false starts were noted. False starts need to be avoided. Please try not to commit any false starts. When you start a sentence, try to finish. Okay, false starts should be avoided or reduced as much as you can. As much as you can, please. Let's continue now.
Is that okay?
Yes, it is okay.
Okay. And also, I'm happy to tell you that he's fit for discharge.
Really? But
Yeah.
but I don't think so, because he's, I already told you that he's complaining pain always. I don't.
It's good, whenever the patient is ready for discharge, whenever the patient is stable, whenever the patient is progressing well, we also need to share the happiness with the patient or the patient's carer or the patient's relative or whoever it is. So it's good, you have been sharing your happiness regarding the child's discharge. So it's good. So the way we have to use phrases are the same way she has been using here. Okay, let's continue now.
When we are at home, what will happen, and I'm worried about that. Is it possible to extend some more days over here in hospital?
Yes, I can understand your concerns are reasonable, but as per our medical team.
So I can understand your concerns. I can understand that your concerns are reasonable. So instead of saying I can understand your concerns are reasonable, you have to say I can understand that your concerns are reasonable. That's what we need to tell. All right. Otherwise, you can simply say I can understand your reasonable concerns. Okay, so that would be more appropriate as well. Anyway, let's continue now.
He doesn't require a longer stay because as much you are concerned that his pain is expected, we will give the pain medication for the pain, and we will prescribe you, instruct you how you have to take care of him at home also.
It's better not to use longer sentences. Longer sentences may contain mistakes regarding grammar, vocabulary, and pronunciation issues. So it's always better to use shorter sentences. So please use shorter sentences and link them together. All right. Because you have committed the mistakes here. You said as much as pain is not correct in this sentence. So it's better to speak small sentences and then connect them together using linking phrases. All right, let's continue now.
So apart from that, he doesn't have any significant problem. So he's is all right to go home.
Okay, when you say he is, you said again he is all right to go home. Okay, remember that false starts need to be avoided. I know even English speakers do commit false starts, but they commit them in less number. All right, we need to avoid as much as possible, please. Okay, you can't just keep on committing the false starts when you speak. Right, let's go to the next one.
Is that anything? Do you have any other concern?
Okay, so you were making a mess here. So you said is that, and then you said do you have any other concerns? Okay, so this is not good. All right, you have again committed false starts. So the one that you can say simply is there any other concern? That's it, finished. Okay, or are there any other concerns? Okay, that is also good. Don't say is that and then you stop there and then you start a new sentence by saying do you have any other concerns? That doesn't look good. When you start a sentence, try to finish it. Even if you use a few words to make it complete, that is absolutely acceptable. Is that clear with you? Then let's get the answer from him, because you have already started is that, isn't it? So you need to finish it. So is that clear with you? That's it. Then let's say he's going to reply by saying yes, and then you can say do you have any other concerns? That's okay. You don't need to mix these things together and then commit false starts. That's not a good idea. Okay, that's not good. All right, let's go to the next one.
No, then it's okay. But what about the medication, dosage, and when it is at the home, because I'm alone,
Yeah, it's a great question. I'm really happy to answer your question because if you go home, you can give pain medication as we prescribe from here that the name is Tylenol. You can give this one 5 ml every 4 to 6 hours at home till he, as long as he experience pain.
Okay, so till he, as long as he, okay. You could have said till the pain subsides. Okay, till the pain subsides, or till he recovers. Okay, till he recovers fully, or you can say till the doctor advises, till the review, okay, of your current completion, of his current completion, or till the review by the doctor. So use these phrases, any of these phrases. Try not to commit false starts, please. Don't say till he, as long as he. These things will not help you. No. Let's continue.
Discomfort. After that, you can stop this one. Is that okay?
Yes, sister, it's okay. What about if he shows any extreme pain or something like that? There is any special, precautions or something we have to.
Yeah. Yes. Apart from these medications, I would like to give you some recommendations in order to reduce this pain and discomfort. Shall I?
Yes, please.
Yes.
Okay. So we don't need to again ask, twice. Shall I? These things are not good. False starts are one of the worst mistakes anyone can commit. I understand you may not be able to avoid the use of false starts. As long as you reduce it to minimum level, you should be all right. Okay, please be mindful about this.
First, you can avoid some crunchy, oily, and spicy food for some days because that will irritate his throat. Could you get me?
Yes.
Yes. Then you can give cold, soft diet like ice cream, juices, or any baked potatoes and.
So any baked potatoes. It should be baked potatoes. We shouldn't say baked potatoes. Okay. Again, false starts. It should be baked. So whenever we have to use ed, okay, at the end of a verb, we have to say t. It's not ikd. Okay, so you can't say baked potatoes. Baked, that's wrong. Okay, developed, that's wrong. Developed, baked. So that's how we have to pronounce. Okay, it's going to be t when we have to pronounce. All right. So please be mindful about this. Don't say implemented. That's how we need to pronounce. Okay, developed, implemented, and so on. Let's continue now.
Mashed rice, like soft and cold diet, you can try. That will help him to soothe his throat. Am I clear to you?
Yes, sister, clear.
And I would like to inform you that please.
Okay, again, I would like to inform. Okay, let's say she started a sentence with the give, isn't it? It's better to say, I would like to give some suggestions. Finish it. I would like to give some suggestions, some advice, some recommendations, some guidelines. That's it. Finish. Then you go. Firstly, I would like to inform, and then you can tell whatever the information you wanted to convey. So try not to commit the false starts. When you started a sentence, finish it, please. You can't just give it in the middle. You can't just stop in the middle and then start from the beginning once again, or you can start a new sentence once again without completing the existing sentence. All right, this is one of the major grammatical mistakes committed by almost every student appearing in the OET examination. That's not good. All right, you need to be a bit mindful. When you do the next role play, you need to be really mindful about this, please. We should not commit false starts. We should avoid, we should reduce it as much as we can. All right, it's very, very important. I cannot stress enough on the importance of reducing the false starts and background noises. Okay, because under pronunciation and grammar, it is going to affect tremendously. All right.
Avoid red color foods like red jelly and red popsicles, etc. The reason is because you cannot differentiate if he has any blood.
When you say the reason is, all right, You have already said because again, isn't it? So the reason is, and then you can give the reason. We don't need to say because. Okay, when you say because, we don't need to say the reason is. So use either, please, and not together. You can't use them together. For example, I would like to recommend you to stay away from, let's say, unbalanced diet because it can harm your health. That's it, finish. Otherwise, you can say, I would like to recommend you to stay away from unbalanced diet. The reason is it can lead to several negative consequences to your health. Finished. I didn't use the reason is because together, isn't it? I have used them separately. That's how we need to use. So please be mindful about this mistake. All right, it's not good. I can sense that there are so many students who are committing this mistake. The reason is that because it is doing da, 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 and then they also use, one more thing. That's why the reason is, or the reason is, that's why, because. So they use all three of them together. The reason is, that's why, and because. All three things are the same thing. It means you are using three synonyms to describe one thing, and that's not good. You can't tell. You can't use three synonyms together. You can't say it is a simple, easy, effortless procedure. You can't tell this. That's wrong. All right, so please be mindful about it. You can say it is a simple procedure, it is an easy procedure, it is an effortless procedure. That's it. All right, let's continue now.
Could you get me?
Yes. That's a good point.
So these are the recommendations you can follow at home.
Okay.
Do you have any other concern?
Yes, my son.
She's able to clarify all the patient's concerns. That's okay, that's a good thing. She also ensured the patient understands all the information. So that's good. So these things are good enough. Okay, as far as the clinical communication language skills are concerned, we need to ensure that the patient is aware of everything and the patient is following all the information we are sharing with, isn't it? So that's good. That's amazing. Okay, but as far as the grammar, pronunciation, vocabulary, connectivity, and all the other parameters are concerned, she has been unable to achieve good score, unfortunately. Okay, let's continue. We didn't finish yet.
He always likes to play with his friends. So when is it possible? I mean, the friends can visit him, and when he go back to his school,
Yes, your concerns are reasonable. Usually.
Okay, so again, you said your concerns again false starts. So it's not good. False starts should be avoided, please, or reduce as much as you can. If you commit maybe only 2 to 3 false starts throughout your role play, it's good, but don't commit more than that. All right, it happens. I know it happens, but it's not advisable to commit false starts again and again, or background noises.
It will take 10 to 20 days for him to get completely recovered, and it depends on some children. Maybe it will be within 10 days they'll be okay, or it may take up to 2 weeks also. Usually after 20 days they can have their normal routine life. He can go to school and all. Are you clear?
Yes.
So when you say he can resume his normal routine life, you can give a connecting phrase after that. Okay, and you can start a new sentence. You can say, for example, he can go to school and play with his friends as usual, as he does. That's it. So you can use a new sentence instead of combining everything together in one longer sentence. It's better to split them together. Split them separately and then provide a pause of 1 to 2 seconds between those sentences. Okay, that can effectively convey the information to the patient or the patient's carer. It is very important that we give enough small pauses after every sentence and after every commas. Okay, for example, if there is a list of things that we are talking about, we have to give a pause after every item that we list out. For example, he needs to follow the medications, diet, and exercise. Okay, so in this case we have to give a small pause after medications, diet, exercise. Okay, so this is very important. Anyway, let's go through the next one.
Sister, yes.
Yes, and I would like to inform you.
Okay, we shouldn't commit again false starts and okay, again false starts. It's not good. It takes your score away from you.
That if you go home, if you experience any pain, discomfort,
If he experience, okay, remember that whenever we have to speak about the third form, I mean the third form of the nouns or third person nouns, let's say he, she, and it, we have to always use verb plus s in the present tense. I mean, it's going to be if he experiences, okay, if she experiences, if she takes, if she exercises, if she walks, if he walks, if he runs. This is how we have to use. We can't say if he walk, if she walk, if she eat. These things are incorrect as far as the grammar is concerned. Okay, so please be mindful about the use of the appropriate verbs and tenses. Okay, right, let's continue further.
fever, or any infection, you can contact our emergency department or our helpline number to get further consultation. Am I clear to you?
Yes, clear, perfect.
Yeah, and also please take this pamphlet. It has a necessary information that will help you to get a clear idea about how to take care of him at home. Okay, please take this one.
Sure, thank you.
Sure. Do you have any other concern?
Nothing.
Nothing. Okay, thank you.
You are welcome.
Okay, you could have managed the time a bit because it exceeded the given 5-minute timeline. So it is very good to finish the role play on time. You have been able to complete it at 5 minutes and 10 seconds. Yeah, it could have been, it's not that bad, but it could have been done a bit early as well. All right, grammar is one of the main areas of improvement. Connectivity could have been improved a lot as well. Pronunciation is another area that needs immediate attention. You cannot give false starts and background noises. Okay, that's not good. All right, remember that, please. Vocabulary is apt. I'm very happy with the way that you have been using the words. Okay, they are all good. The way you have been using the polite phrases, the way you have been showing the sympathy, everything is okay. However, grammar, connectivity, pronunciation need to be improved a lot. Okay. All right, let's go to the next one. What would be the next one? Yes, your sympathy was exceptional. I think these are the assessment parameters. You could have done a better job. Let me give you the score for this. Okay. Right, I'm really strict as far as the assessment of OET role play and letters are concerned. If you pass my assessment, you will surely pass the real OET speaking and writing subtest. Okay, so you have been committing so many mistakes, especially the false starts that can take you, to the C+ grade, unfortunately. Okay, so for this, based on the severity of the mistakes and the number of mistakes, I'm not happy to give you 350 out of 500 for this role play. According to me, this one can get you somewhere around 310 out of 500. You could have done a better job, Nitya. However, it is your first attempt, so it shouldn't be an issue. I hope you can identify these mistakes and avoid them in the future role plays, and you can definitely improve your score. Please focus on your false starts because that can prevent you from scoring well. All right, I hope you can improve your score in the next role plays. Thank you so much.